Much better. Oh, yeah. So then you could opt for Welcome, sir. Please come. We're just to kindly stand to welcome our chief guest.
Photo.
And good morning, everyone. Sir, I'm just making sure everybody's alert and awake. All right, for orthopedic surgeries, a very warm welcome to every member in this audience, including our chief guest, Mr. Arbaaz Khan, and very chief doctors who are in the room, a lot of seniors from Apollo Spectra, and esteemed members of the press. On time. Thank you. My name is Sonika Chopra. Joy and a pleasure and honor to be doing this with all of you. May I have the selfie with them?
बीच का कैमरा निकालो.
Can we have the music with the lamp lighting, please?
अरे ग्रुप ही है.
Everybody towards the right.
Thank you.
Ladies and gentlemen, a big round of applause for the launch of our event. Welcome once again. Like I said, it's an honor for me to be here and be doing this. I shall now do a quick introduction of Apollo Hospitals with an unparalleled legacy of 41 years. Apollo has been established in 1983 by Padma Vibhushan Dr. Pradeep C. Reddy, renowned as the architect of modern healthcare in India. Apollo Hospitals is acclaimed for pioneering the private healthcare revolution. No introduction, but it's my job to give it anyway. Mr. Arbaaz Khan is an established actor in Bollywood for many years now, and also a very strong producer. Since his debut in '96, he's acted in many leading and supporting roles, ventured into film production with Dabangg in 2010, in which he starred as the younger brother of his real-life brother Salman Khan. Both of you make a fantastic duo. The film went on to become one of the highest-grossing Bollywood films of all time, and he's won the National Award for Best Popular Film, providing wholesome entertainment for the film. We are all, ladies and gentlemen, very happy to have him get some time out for something very important for us. So will be lovely if, ma'am, you can honor him with a small bouquet, token of our appreciation for being here this morning. May I please invite Dr. Vijay Agarwal to also do the honors for all the other important invitees today. Ms. Rupanda, if we can felicitate you now, Dr. Vijay, if you will please do the honors of giving a small token of our appreciation to her. Dr. Vijay, if you will please continue to give us just a couple of more minutes to felicitate Mr. Rajkumar Seksaria. Center. Thank you, sir. Thank you for being here. Good morning, Dr. Safiuddin Nadvi, consultant orthopedic. Maybe please do a small honor for you, sir. Dr. Safiuddin Nadvi. Nadvi is a distinguished orthopedic surgeon with over 21 years. Dr. Alok Pandey is a consultant, joint replacement and orthopedic surgeon with over 15 years of experience. He has successfully performed more than 1,000 joint replacement surgeries, excelling in complex primary and revision hip and knee replacements. Can we now have Mr. Nishant Mishra, CMO. I believe we have the honor of having the Consulate of Oman, Badar Wahebi, with us. May we please have you on the stage for a second, please.
Hello. Good afternoon, ladies and gentlemen, respected dignitaries on the dais, distinguished guests, doctors, and my friends from the media. It's an absolute pleasure to be here today, being a part of this healthcare event. Thank you, Ms. Kaur, Dr. Vijay, Dr. Alok, Dr. Safiuddin, and the entire Apollo team, and the management for giving me the honor to be here today. The field of healthcare is deeply connected to society, and being a health and fitness enthusiast at personal level, I'm really thrilled to be among such a gathering. I'm sure whenever we think of healthcare or hospitals, one name that always pops up in our mind is none other than Apollo. And that's the leadership status and legacy Apollo has achieved today, with the decades of hard work, patient service, and commitment. Today, India is one of the front runners when it comes to quality healthcare, and our doctors are second to none. The whole world looks up to India for quality and cost-effective medical treatment. All this started with the vision of Dr. Pratap Reddy 40 years back. I'm sure Apollo will continue to lead the way, bringing many more innovations and shaping the future of healthcare in India and beyond. When we talk about innovation, I believe technology plays a very important role. AI is transforming healthcare system by enhancing treatment outcomes and improving overall patient experience. Technology has changed the way we live, and even healthcare is not untouched by it. If you are likely to develop a heart problem or maybe osteoarthritis in the next 10 years, you can get to know it today through some tests thanks to Apollo Pro Health. Imagine how easy, safe, and simplified our lives have become thanks to such advancement made by Apollo. Then in case of surgeries, I remember back in the day when an injury to the bone or joint, especially in sports or cricket, would bring a long and painful recovery. You would now have to undergo open surgery. It would take months before you could fully recover and return to the game. But now things have changed so much. The technology is advancing so rapidly. Although robotic surgery has been around for a while, I've heard so much about the benefits: high accuracy, minimal scars, and extreme fast recovery. But what makes this even more special today is the fact that Apollo Spectra is offering this advanced technology in a daycare, boutique-style, multi-speciality hospital setting. I believe this is the first, and it is a fantastic news for the people of Mumbai. It means quicker recoveries and fewer disruptions to people's daily lives, which is what we exactly want. Spectra is a pioneer in daycare and short-stay surgeries, offering cutting-edge technology that helps patients recover faster. They have truly revolutionized the way people approach medical procedures, and it's no surprise that they are the best and fastest growing chain of hospitals in this niche area. As we witness the launch of this robotic knee replacement system today, I am truly excited to be here in the company of so many esteemed doctors to witness the milestone in the field of orthopedic surgery. It's a revolutionary step forward, not just for Apollo Spectra, but the healthcare industry as a whole. Thank you, doctors, who are doing an incredible job of bringing the highest level of comfort and care to the patients. For all that, I applaud you. And it's been an honor to be here. Thank you very much. Thank you, and all the very best.
Row of guests, and you will allow us a few questions. Ideally, I want to ask what exercise you do, but I'm bound to ask you medical-related questions today. So as you have self-admitted that you're a fitness enthusiast, clearly, what would you think is good medical advice for people who are fitness enthusiasts, especially when they're not in their 20s anymore? But you're probably teenagers now, you and your row of brothers, yes. How do you do that?
So the first, can you hear me? Hello? Yeah. I think the most important thing is to be active in some form of exercise if possible. Sedentary lifestyle is probably the worst thing that you can do to your health. It's
Agreed,
even worse.
yes.
It's even worse than smoking or drinking or any abusive habit that you have. Because when you exercise, I think that's the time when, whether it's, flushing out toxins from the body or building muscle, because we now know that muscle is a longevity kind of organ, it's like it helps you live longer, because as you grow older, you need your muscles to get up, to do activity. So when you exercise, you're also helping your joint health and all of that. So any form of exercise, whether it is swimming, running, basketball, weight training, aerobics, or any kind of those, yoga for that matter, are very, very essential and important for mental and physical benefits.
Right, and you mentioned something really important, which is joint health.
Yeah.
So how do you prevent joint injuries, especially if you're
Basically,
regularly
one has to be mindful about what kind of postures that you are in, even while you're exercising.
Correct.
Okay, so those are important. Warm up before any kind of an activity is important, because some people who are doing weight training sometimes just hit the gym and they just get into a kind of a workout which is probably they're not yet prepared, because I think the body still needs like maybe a 5-minute kind of stretching or something.
Correct.
Stretching is a very important thing. Stretching is also something that is very essential. So these are the few things, if you do, they will really keep away from, let's just say, a person who exercises and has a fall, and a person who doesn't exercise and have a fall. If you have muscles around you, you can protect your bones.
Right.
People who are stronger, if you like, let's just say the kind of acrobatic stuff that say a WWF guy does. He gets thrown and flung around and all of that happens. Why doesn't he get hurt?
Springs back up in a microsecond.
Why doesn't he get hurt as much as a normal guy? If he had just probably twisted his foot, what would happen to him? It's because you don't have the muscles to protect your bones, right? So I feel that muscles take away a lot of the injury shock. So the first most
the
important...
doctors are agreeing completely with what you're saying.
The first most important thing that you need to do is to build muscle, because that's your protective gear towards any injury that happens. People who have muscles will survive far greater injuries than people who don't have muscle.
Great, fantastic. So all this medical information that you are
when I was very young, I was around 14, I met with a very serious Jeep accident, and I was flung from an open Jeep and I landed on my leg and I broke my femur.
At 15?
Yeah, I was about 14, 15 years old, and I had a horrible injury. Fortunately, it could have been even worse, because I landed on my leg, I could have landed on my head or whatever. And I had a mangled leg right in front of me, which had swollen to some God knows what size. So the accident happened at about 11:30 in the morning, but my first attendance that I got to the doctor was about 4:30 in the evening, because first we had to go to my family doctor, then he suggested what needs to be done. So I was in a taxi till then, and my first medical attention happened at about 4:30, and then the doctors, because I was young at that time, had decided whether they decide that I should be put, my leg had to be, the bones had to be screwed or to be put on traction. So I think that time it was Harkishan Das Hospital, and it was Dr. Bansal, if I could recollect. He was the one who kind of attended to me, and he probably took some time to say whether they should do those screws on my leg or to this.
Did you have screws in your leg?
No. So
Okay.
he took the decision for me to have traction. But it so happened is that when I healed, sometimes the bones don't join accurately.
Correctly,
So
yes.
I had a limp for almost a year and a half,
Oh.
because my leg had probably been a little shorter than because of the injury, the joining. So I had when the reason why I'm also very happy to be here because of the orthopedic situations of injuries to the bones is because I've undergone that scenario.
Yes.
And it had happened at an age where children play sports. So I used to play squash, and it was a high impact sport at that point in time. And because I broke my femur, I could not play those high impact sports for about a year, 2 years, and then it was never the same. So I could never recover to the what a
perfect.
normal fitness.
Yeah.
I did everything. I played all the sports. I played squash again. I swam again. I played cricket, whatever. But I always knew that my left leg was
It
never
will
the
be.
same because it's the strongest bone in the body, right?
Did you wish for some robotic surgery?
Like I said, had
Or
that
orthopedic,
situation,
then
that's what I'm
yes.
saying, maybe had that situation
Yeah.
happened, maybe my recovery would have been faster, maybe my healing would have been as near normal as it should be.
Right.
So technology has come. I think people of today are actually luckier and blessed that that this situation is there, and I applaud all the people who indulge in this kind of technology. That I wish them all the best, and doctors who perform these.
Doctors are sounding as excited as teenagers using this robotic surgery.
yeah.
It's lovely to see.
But I'm sure robotic surgery, but it's all assisted by them.
Of course.
It's all done by them. The robots are doing what they're being instructed to do.
Yeah, absolutely. Yes,
Yeah.
absolutely.
Thank
But
God.
that's a lovely sharing. That's so lovely of you to share something so personal, but it's absolutely appropriate for today's launch event. How do you see the role of technology?
I think technology is something that is growing ever since.
Yeah.
Like in every field of our life, we are using technology for anything for that matter. So I guess.
AI, robotics, it's all very
Yeah. Now,
exciting.
how much of it is going to be misused? Because like everything is like they both are like a knife is used for cutting fruits, and also it can do some harm the other way.
Correct,
So
correct.
everything is, whether the internet or any kind of social media for that matter,
Right.
it's used, if it's used in the right way,
Then it's very
very
advantageous.
good.
It's a good thing, yeah.
Similarly, if AI is used for detecting illnesses maybe weeks or months, years in advance, which is
Such a blessing.
which is
Such
it's
a
very good
blessing.
that you're more probable that you're going to get this kind of a disease or this kind of
Yeah.
something happen
That's
to you, and if you
fantastic.
could come to that conclusion, it's very good that you could prevent so many of those illnesses or situations which probably would
And prevent disaster.
Yeah.
Right.
last minute, which
Fantastic,
complication.
lovely. So lastly, about Apollo, I have some weird stories from my childhood. I used to wear an Apollo bandage just to look fancy because Apollo was a fancy hospital. Any stories you have? Apollo is today a leading name.
Yeah, so we always heard of this hospital because some of the very prominent people used to be admitted.
Exactly,
So
yeah.
it's like any kind of dignitary or any kind of statesman
Yeah,
would
Apollo was
or
the name,
probably
trusted
had a
name, yes.
severe heart attack or needed a very, very serious surgery. I mean, the only hospital that we used to hear about where they used to go or they used to want to go was
Yeah,
Apollo. So that's
yeah.
something that they've earned since ever, so that's a great name,
Yes,
Yeah.
that's right. All right. So I hope you and your family never need to use a hospital.
If that is the case, then probably Apollo is the
Apollo,
place.
right. Thank you for your time. Lovely conversing with you. All right, I will. Mr. Sheikh, if you will just do the honors, please. Good morning and thank you for being here this morning, sir. Lovely to have you here as one of our esteemed guests.
बहुत बहुत शुक्रिया सेम
रोबोटिक होने वाला है अब जैसा कि
सर्जरी जी
लोगों की सर्जरी की प्रॉब्लम जो है सब कुछ रोबोटिक होने वाला है। आप जब यहाँ पर आए हैं अगर आप स्पेशली आप बातें करते हैं तो क्या आप कुछ कहना चाहेंगे कि ये जिस तरह से रोबोटिक होने वाला है लोगों की सर्जरी नहीं चिकित्सक से लोग बचेंगे या ऑपरेशन से बड़े बड़े ऑपरेशन से बचेंगे तो ये टेक्नोलॉजी के बारे में क्या कहेंगे?
तो सबसे पहली बात तो मेडिकल फील्ड में बहुत एडवांसमेंट हुआ है और जैसे कि डॉक्टर आलोक ने डॉक्टर सफीउद्दीन ने कहा है कि जो एक 20% जो पेशेंट्स जो कभी कभी सर्जरी से ना खुश होते थे। अभी ये रोबोटिक सर्जरी जो इतना एडवांस्ड है, जो उसकी प्रॉपर मैपिंग करती है, जो पूरा एक्यूरेसी के साथ वो हेल्प करती है, असिस्टेड बाय द डॉक्टर्स, उसमें वो गुंजाइश जो है वो कम हो जाती है। Advancement is happening in every field, and so is happening in the medical field. And this is a very welcome introduction into the medical field. Okay, the robots are going to help, make surgeries a little more easy, and recovery will be faster, precision will be much better. So इसका ये बहुत बड़ा advantage है।
डॉक्टर, मैं आपसे ये जानना चाहती हूँ कि यंग एज को भी ये प्रॉब्लम हो रही है, इसका रीज़न क्या है?
Arbaaz has already told that the most important reason is that we don't exercise. We have very sedentary life. We gain weights. We use unwanted food. We are not having balanced diet. So that is the reason why we are having arthritis in early age.
So
even we have seen arthritis the knee getting bad at the age of 32, 30, even less than that.
जिस तरह से टेक्नोलॉजी बढ़ रही है तो बहुत कम लोग होंगे, जैसे कि गांव एरिया में तो इतनी पॉसिबिलिटी नहीं होगी ना कि लोग यहाँ तक आएंगे और इस टेक्नोलॉजी को यूज़ करेंगे। वो कैसे आप वहाँ तक कैसे पहुँचेंगे?
We are trying to reach out that. We are having a special plan for that people, and Spectra is that to help those people only. Because as my CEO, Ms. Rupender Kaur, has already said that we have this thing, because when we go to the tertiary hospital, definitely the things are being on the higher end. So we are giving everything which normal people, as you said, the people who don't afford for that. So we are trying to accommodate those people in our hospital.
बस मैं आपसे ये जानना चाहती हूँ कि क्या इंस्पायर करता है ऐसे इवेंट्स में पार्टिसिपेट करने के लिए आपको?
तो ये डेफिनेटली एक सोशल अवेयरनेस इवेंट्स होते हैं हमारे, जो नॉर्मल जो हम इवेंट्स एक फिल्म पर्सनालिटीज जो अटेंड करते हैं वो दे आर अ लिटिल डिफरेंट फ्रॉम दीज आर वेरी cause or oriented events which we as people from the society should also kind of encourage, because this is something that we need to embrace in terms of the technology and all that stuff. So Apollo Hospital has been doing such great work over a very long period of time, having some of the best doctors taking care of people, and whenever they come up with some new technology and whenever they come up with advanced methods of operating, I think it's good to bring awareness in that sense. तो इस वजह से कभी भी ऐसे अपॉर्चुनिटीज़ मिलते हैं कि ऐसे इवेंट्स में अपने आप को पार्टिसिपेट करना या कोई अवेयरनेस लाना, तो somebody like me is always very up to it.
So nowadays हम बच्चे जो हैं वो सोशल मीडिया पे ज़्यादा एक्टिव रहते हैं। हम बाहर के अपनी इंजरी की बात की थी, जब आप 14 साल के थे जो इंजरी हुई थी, तब उस टाइम पे सब खेलते थे। आज के टाइम पे हम एक कोना पकड़ के अपने सोशल मीडिया, अपने इंस्टाग्राम, ये सब कुछ छोड़े, तो ये सारी चीज़ों के कैसे निकले बाहर? और पेरेंट्स भी अब इस पर कुछ रिएक्ट नहीं कर रहे।
आई गेस तो पेरेंट्स हैव टू प्ले अ वेरी इंपॉर्टेंट रोल इन दैट। अभी जब तक बच्चे आपके कंट्रोल में हैं तब आप उनको एक होता है कि टाइम दैट यू अलॉट देम फॉर being on social media and all that, everything has to be, बच्चे, you cannot completely deprive them. ये तो फैक्ट है कि आज बच्चों को लैपटॉप, आईपैड, फ़ोन से आप बिल्कुल दूर नहीं रख सकते। उनका सिर्फ आप टाइम मिनिमाइज़ कर सकते हैं, क्योंकि कुछ चीज़ें ऐसी हैं कि उनको आप एकदम डिप्राइव करोगे तो वो पीछे भी रह जाते हैं, बिकॉज बहुत सी चीज़ें आज you learn from the internet and all that stuff, and you don't want your child to be totally lagging behind, but you should minimize the time for everything. There is a small time that is allotted, जिसमें स्पोर्ट्स इम्पॉर्टेंट है, रीडिंग इम्पॉर्टेंट है, सोशल मीडिया के ऊपर भी पार्टिसिपेट करना इम्पॉर्टेंट है। तो आई गेस वो सिर्फ क्या होता है कि टाइमिंग का आगे पीछे हो जाता है। लोग चिल्ड्रन आर स्पेंडिंग फार मोर टाइम in their rooms, and they're on social media and on phones than they are on playgrounds or in being active in any sport. जैसे कि मैंने कहा कि आज सबसे ज़्यादा जो बड़ी बीमारी जो है ना वो है sedentary lifestyle. There is not a single disease or a problem that doesn't come from sedentary lifestyle. You could be you could be a vegan, you could be a vegetarian, you could not be drinking, you could not be smoking, but if you sit on a chair all day, you will have more problems than people who are doing any of these, because they exercise and whatever it is. So it's being active is the first most important thing. जब भी आपको मौका मिले आपको थोड़ी सी एक्टिविटी करनी चाहिए, और वो आपको बहुत सी चीज़ों से बचाएगा। तो बच्चों को सबसे पहले वो बहुत इम्पोर्टेंट होता है। समझाना.
So Arbaaz, any quick fitness tip to the youth?
Like I said, first and foremost, get involved in any kind of physical activity, and along with physical activity, I think today what is really needed is improving your mental health, because we have been affected a lot by so much of things around us that today every news is coming to us, good, bad, ugly and all. And सुबह उठते हैं तो हम इंस्टाग्राम ऑन करते हैं तो हमने कुछ ऐसी चीज़ देखी, न्यूज़पेपर पढ़ते हैं या टीवी देखते हैं, तो कॉन्स्टेंटली हमारा जो दिमाग है ना वो कॉन्स्टेंटली आई वुड से नेगेटिविटी से, बट बहुत सी चीज़ें जो पहले हमको इतनी नहीं आती थी खबर सुनने के लिए, हमको बार बार भी गेटिंग kind of bombarded with that kind of scenario, and it has an impact. So how to desensitize yourself from it, how to get numb to it is also important. Let's just say that they are orthopedic surgeons, right? अभी इनके पास किस किस्म के केसेस आते हैं? इंजरी टू एन एक्सटेंट, कोई गाड़ी का एक्सीडेंट हो गया, कोई गिर गया, सीढ़ियों से गिर गया, कुछ हो गया. अब ये अगर डर जाएंगे खुद के, अरे ये क्या हो गया, तो ये ऑपरेट नहीं कर पाएंगे. You got my point? So they have to be in a very good state of mind. Similarly, I mean to say, with all what is happening around us, we also get affected by it. How? एक तो है कि हमको सेंसिटिव तो होना ही है दुनिया में जो हो रहा है, but at the same time how we can still keep our mind cool and not overreact to things, and how not do any kind of counteract on that sense. So mental health along with physical, it's a combination. तो दोनों चीज़ें, so whether it's yoga, meditation, things that you read, learn, बहुत ज़रूरी होता है वो सब चीज़ें करना.
Thank you Arbaaz ji. Thank you everyone. Thank you so much.
Thank you.
Any message for Spectra?
Spectra, I mean to say, they're doing a great job. They are so advanced in their technology, and they keep coming up with innovative ways to treat people. And I guess that's their policy, and that's how they're going to keep going from strength to strength. They're amazing. Yeah.
Thank you so much Arbaaz.